Good morning, students. Today I will discuss a different topic. The term of the topic is probably we have heard at many places and even at your home also, where suppose one basin is fitted at your home and one pipe is connected to that basin so that the water from that particular basin goes outside. That means through which one end the water enters and to another end the water goes out. That means one is the inlet, one is the outlet. But today I will use this term in our anatomical purpose, where we will get the inlet and outlet, both these terms. Suppose in our thoracic cavity there is one thoracic inlet and thoracic outlet. Similarly, in bony pelvis one is pelvic inlet and pelvic outlet. But today I am here to discuss only the thoracic inlet, and others I will discuss in some other videos in some other day. Let's see what is this thoracic inlet. Look at this. This is nothing but a very simple plastic container. I will show you how this is correlated with the thoracic cage. The wall of this container is the thoracic cage, where anteriorly sternum and anterolaterally is the ribs and posteriorly thoracic vertebra. And this is one end, this is another end. This upper end towards the neck, this end, it is called thoracic inlet, through which the structures enter into the thoracic cavity. If the thoracic cavity, there are so many structures inside thoracic cavity like heart, lungs, esophagus, so many arteries, veins, nerves, lymph nodes, so many structures are within thoracic cavity. And below the thoracic outlet, which is closed by the diaphragm. Though there are some apertures, important apertures, through which some important structures either pass from thoracic cavity to abdomen or from abdomen to thoracic cavity. But that I will discuss in some other day. Let us concentrate on the thoracic inlet, this one. If I show you this one, this aperture or this aperture is the thoracic inlet. The boundary of this inlet, you see, this is the sternum, is the manubrium sternum, and this is the upper end or upper border of the manubrium sternum. And this is this color, pink color, this is costal cartilage which articulates with the manubrium sternum. This is the rib proper or costae. So, this rib of this side, this is the first rib of this side, both are first rib, and posteriorly is the first thoracic vertebra. This one first thoracic vertebra is the body. So, this inlet is bounded anteriorly by the upper border of the manubrium sternum, anterolaterally by the inner border of the first rib, and posteriorly by the anterior surface of the body of first thoracic vertebra. So, if I see this shape of this inlet like reniform or kidney shaped, and it is sloped downwards, so that this end to some extent lower than this end, and the transverse diameter of this inlet is much more than the anteroposterior diameter, just like double. If it is 5 centimeter, it is about 10 centimeter transverse diameter, and the anteroposterior diameter of this inlet is about 5 centimeter. Though this aperture is anatomically termed as thoracic inlet, but so many important structures come out through the aperture into the neck, like the branches of the aorta. So, it is a misleading or misnomer term, because though the important structures pass through this called inlet, but some of the important structures again come out through this inlet. So, it should be the outlet in that case. So, better to term, so many anatomists use this inlet as superior thoracic aperture. Similarly, inferiorly, where the diaphragm is there, this is called inferior thoracic aperture, but anatomically we use the term as thoracic outlet, which is closed by the diaphragm, though some important apertures are there in the diaphragm. But what is the importance of this superior thoracic aperture or thoracic inlet? That is thoracic inlet syndrome, which is very important and from clinical anatomy, and it is commonly asked in theory examination and also in practical examination when you are asked to hold this or to show the thoracic inlet, we usually ask what is thoracic inlet syndrome or what do you mean by thoracic inlet syndrome. That syndrome I will discuss in some other video, not today, but today you should be clear regarding the anatomical boundary of the thoracic inlet. So, that is all for today. So, if you feel any difficulty in understanding, you may write in my comment box, and please click on the like button and of course subscribe it and share to your friends. Thank you.